Well, as I mentioned, I really wanted to be a pediatrician. I really didn't know how to navigate that. My parents told me that once I wanted to be a pediatrician, that I couldn't get off that path, and that someone was going to tell me, I wasn't going to be a doctor, but that I needed to stay on this goal. When I was at UIC, my counselor told me, even though my grades were average, don't see a pre-med advisor, because that person was going to say, it was going to happen. So that's exactly what I mentioned. I had to see LMSA, the Hispanic Center of Excellence, get into this mentorship program and find people who are my tribe. My parents always told me, for example, dime con quién andas, te diré quién eres. And really, I didn't, when your parents tell you stuff, you're like, whatever, I don't really believe that. But I really tell that to my mentees as well, because you really need to find a tribe. People who always uplift you will always keep you through that path. If you're hanging out with people who are like, oh, you're not smart, you're never going to make it, medical school is hard, go into something else, be, a nurse, which nurses are amazing and I can't do my job without them. But if they tell you to do something else, or I've had friends go, oh, what's going to be your plan B if you don't go to medicine? I never had a plan B. I didn't get into medical school right away. I always had that as my plan A. So I really think that if that's your passion, always keep it as your plan A and never go for a plan B. So I would say that that's key.
Yeah, y tienes que tener garra, which is absolutely what your parents instilled on you. And we talked that your father's Bolivian, your mother is Cuban. Both came to the United States right away, specifically to Chicago. And education was such an important part of your upbringing, that foundation to reach success. And how many people have been told, unfortunately, you can't do this, you can't do that, whether it's because of your socioeconomic background, your ethnicity, your race. So what a wonderful example of really, and it's really difficult, especially for a young person, of swimming, against the tide of just such negativity. And then the last thing I would say to your point, yes, right? Surround yourself with people who are going to lift you up, beginning with yourself. We cannot be, we have to be our biggest cheerleader, and not kind of buy into some of that negativity, because if we don't lift ourselves up, how are we going to, inspire others to do the same? You were able to get a proclamation in the city of Chicago and Rockford for National Latino Physician Day. Tell us why that was so important for you.
Well, October 1st, as of last year, was the first time we did National Latino Physician Day. And the reason why we wanted to create this day, a few physician friends of mine really wanted to found this day, was because we wanted to inspire, young people to, one, become physicians, and two, create awareness that only 6 to 7% of the physician workforce is Latino. Only 2% of the physician workforce are Latina. And yet 20% of the U.S. population is Latino. We need more, necesitamos más, because we're seeing that this really affects healthcare. We need culturally competent care. When I see patients, I'm seeing them not just speaking Spanish, we talked about language, but also that cultural competence, that cultural awareness. When I see them, I understand that when they're giving remedios, I understand that they're going to tell me about those remedios and they're not going to feel embarrassed about talking about them. And that when, I'm seeing a baby in the office and the sibling says, Doctora, my tummy hurts. I look at the mom and is like, oh, is it really hurting? She's like, no. I'm like, oh, sana colita de rana, and it's fine. That is what that counts as cultural competency, right? Cultural awareness. Only I can do that to that patient, right?
We all know sana patita de rana is an all cure. Another all cure is mentolato, right? And if you don't know what mentolato is, it's like Vicks, right? That cures everything. But part of our culture is also some of these home remedies from our abuelitas and our mothers. Now, you mentioned about cultural competence. a lot of times, and especially now because of access to technology, we're self-diagnosing. What advice do you give to parents about self-diagnosing and some of these home remedies that, we believe they're all cure, but well, maybe they are. But maybe mentolato is. We'll talk about that. But what advice do you give them?
Well, one is I think that there is so much that Google MD can do, right? Even, I think there's, it's good to do a little bit of research, but still come into the office and tell me what your diagnosis is, right? Don't be afraid to share that with me. And then I can tell you, okay, XYZ, I think you're right. XYZ, I think you're wrong. Sure, you can try some of these remedios or some of these things, or actually study shows that this might be bad for you. Sometimes these things are okay. Honey, actually for a cough above age 1 is actually a great thing. Do that when you have a cough. Other things can be harmful, but definitely share them, because I'm not gonna, papa them, because I come from a culture that tries these things.